I would rather you spend 10 or 20 minutes doing strength training exercises and breathing techniques and doing things that are going to kind of give you long-term optimization versus sunning your vulva. So, do I think it's a negative? No, but I think it shouldn't be the only solution to long-term pelvic floor and vulvar health.
Got it. Do you, okay, when you think about physical therapy in this arena, it sounds like my worst nightmare. Um, I need to take my annual appointment. I used to have to like really prepare myself mentally, but now I've gotten better. A couple surgeries and catheters later, I'm like, meh, I guess I don't care anymore. But what does that entail? I mean, from what was going on in Hollywood for a minute was this like whole craze of like people are going to get their vaginas, their pelvic floors handled, and people's, random they're going in there with their
Yeah,
hands and they're
we
doing
go in
stuff.
there.
So
Yeah.
tell me and everybody what that is like.
I think it's really funny because we don't think about muscles in this part of our body. But as a physical therapist, we work with muscles and tissues and nerves in your body. And I happen to work with the muscles and tissues and nerves in the pelvic region of the body. I also think it's really funny because we'll get patients or clients who call and they're like, what should I wear? I'm like, whatever you want because you're going to be naked from the waist down. So it's like, but typically what we do is an initial session will be in a private treatment room with a physical therapist. And you do have to have special training to be a pelvic floor therapist. It's not, we go through specialized courses. I have a board certification. So there is a training you go through. And you sit and talk about your symptoms. Even if you're coming in for painful sex, I'll ask you about your childbirth, your menstruation, your peeing, your pooping, all of these things. We do look externally first.